Alright, so I was going to do my assessment on an actual person if my mama was here, but since she's in Honduras, she was supposed to be here a couple days ago, but I guess her flights got canceled until next month. So for right now, I'm just going to do it on my hippopotamus, and I'll end up re-recording this when I actually have a real person to do it on. So first off, I would check the scalp and the head and everything, make sure that there's no lesions, bumps, any unusual scaling of the skin or whatever, any lesions, any bumps, any wounds. Since the ears are right here, I would, if I had an otoscope, I would check inside the ears, make sure there's no redness, no swelling, make sure that the eardrums are good. If I was going to take their temperature tympanically, I would pull their pinna up and back, and there shouldn't be any tenderness or anything when doing that. Next, the eyes. So I would check accommodation of the eyes. So I would shine the light in one pupil and make sure that the other eye is also dilated to the same extent. And then I would repeat in the other eye, make sure it is to the same extent. I would have the patient look straight at me. First off, I would have them cover their right eye. And make sure that they can still see me, that I don't look blurry or anything. And then see if they can see. I would have my Snellen chart out and see if they can see through the Snellen chart. And then from there, I would go ahead and, while they have their eye covered, I would go ahead and check their, the periphery. So I'd have my hand out and I would have them signal if, maybe I hold a number up or maybe wiggle my finger. They would have to let me know through their peripheral vision if they were able to see it, and they would let me know if they could see it. And then I would do the same thing again with them covering their left eye and follow the same tactic. And of course, with the Snellen chart and everything too, that would check their visual acuity to see at what level of vision that they have. So, y'all don't be fighting. Anyway, so with that said also, I would have them look straight at my nose, and I would check the coordinates, their visual level coordinates. So I would go ahead and make the H shape and make sure that they can follow, my motions. And of course, you would be looking at the eyes, you would be assessing for any redness, any swelling of the conjunctiva, so on and so forth. And of course, when you're doing these tests, if they normally use glasses, you would allow them to use their glasses. So going onward, with the nose, I would use my pen light to shine up in the nose to make sure that their septum is intact, that there's no light shining on the other side. I would check for any discoloration within the nose, any lesions, any bumps, so on and so forth. I would also, at this point, I would check the patient's, I would also at this point, since I'm working with the nose, I would check the patient's olfactory. When I'm in a clinic or something, the easiest thing to do is use a cotton swab with some alcohol in it and have them close their eyes and have them identify what the scent is, and with their first cranial nerve, it should be able to identify the smell because it is a common smell. Then as I'm going there, I would go to the mouth. I would have the patient open their mouth and say ah. I would make sure that the tongue is midline, and I would also make sure that their uvula is midline. I would use a tongue depressor too to also take a good look at their tonsils and the back of their throat, make sure that there's no redness, no swelling, and I would check under the tongue to make sure the same thing, that there's no redness and swelling. And when they say ah, you would make sure that the uvula is not deviating to one location. At this point then, I would go on to check their ability to make like their faces. I would have them raise their eyebrows, smile, frown, puff out their cheeks, and then from there, I would go ahead and I would have my cotton thing. What do they call this? The cotton tip applicators, because those are usually made out of wood. So I would go ahead and break one in half, lightly, touch their sensory. I would say is just light, sharp, dull. Have them close their eyes. Check each side of their face, because you want to make sure that everything is even for any inconsistencies. The same thing, you would check both arms and both legs for sensory. Um, Sorry, my neighbors were having to get together and everything, so I had to close my window in the back here. Anyway, where I was at was I had to check their sensory, so I would check their arms and their legs as well for any sensory differences, and I would also ask the patient if they have any tingling or any odd feeling within any of their limbs, as well as I'm checking for their sensory. Let's see, what else did I do? Face. Okay, and then so at this point, I would also ask the patient if it's okay to touch them again. So with my gloves on, I would actually start from actually here behind. I would actually touch the face to make sure that they have even sensation on both sides of the face, and I would also move down to their chin area. While I'm here, I would go ahead and have them swallow for me. So I would feel for their thyroid, and as I'm right here, I would also check their lymph nodes coming up their neck and into their facial area, like right back here. So I'd be checking the lymph nodes for any hardness or any, and of course any swelling, and if they have any tenderness in that area. I would have the patient take a sip of water too to check their ability to swallow as well. So from there, I would go ahead and I would check their, while I'm here, I would go ahead and check their cardiac. So I would take their apical, then move down, and then move over. And then while I'm listening, I would go ahead, while they were sitting up and I was listening to their heart, I would go ahead and flinch back to their lungs. I would do a ladder motion, kind of move to the left, have them every time I move my stethoscope to breathe deep, okay? And while I have them sitting here, I would check for any CVA tenderness. I would kind of hold the side of their spines and have them say 99, 99. And of course, while they were like this too, I'd be assessing the skin to make sure that there's no lesions and so on and so forth. Also, so as I go to the front, at this point, I would go ahead and be checking, before I have the patient get up, I would check reflexes as part of the neuro. So I would check the bicep and tricep reflex, and of course the Achilles and the patellar reflexes. So I would make sure that they were all good. So you checked the bicep and the tricep, the patella, and the Achilles. And the Achilles, of course, is going to be in the back of the heel. So from that moment, I would go ahead and have the patient stand up. And the patient from there, I would be standing between them. I would have them close their eyes and see if they can, and have them close their eyes standing upward straight, and do the Romberg's test on them, which means when they close their eyes, to make sure that they don't lose their balance. It's normal for them to sway a little bit, but if it's too excessive and they become a fall risk from then, that's usually not a good sign. So you want to make sure that they can stand with their eyes closed. You want to give them a gentle shove. Like, you don't want to push them. You just want to give them a gentle shove. If they end up having to use both of their legs to keep their balance and everything, that's also a positive Romberg sign. So let's see here. You would also check for their gait. You would have them just walk a few feet in front of you, and then you want to check and make sure that they're not having to put any extra effort in their ability to walk. If they're using any assistive devices, you want to continue to allow them to use their assistive devices, even when assessing their ability to ambulate properly. Okay, so now that the patient had been up and walking, we're going to go ahead and have the patient lay down again. So when the patient is laid down, from that point, I would inspect the abdomen. I would make sure that there's no sign of ascites, no excessive swelling, any tenderness. I would inspect the abdomen, see the shape of the abdomen, and then from there I would also take the abdomen and within the four quadrants. And then once I check the four quadrants for a full minute, each quadrant, I would from there palpate the abdomen, especially in key areas where they could have any tenderness or pain. You want to make sure that you palpate good in all the quadrants, to make sure that there's no abnormalities. But before you do that, you want to percuss. Before you palpate, you want to percuss. You want to make sure that where the sound is, you want to make sure it's tympanic where it needs to be and dull where it needs to be. If you can hear the liver, it's probably enlarged. If you hear a dull area on the right upper quadrant, it is probably an enlarged liver, because you shouldn't really feel it. So from then on, I think that's it. While I'm focused on the legs, I would go ahead and check for any edema. Another thing that you could do with your patient is have them hold their arms out straight in front of them. Make sure that they were equal. When they're holding them out, make sure that one's not going to one side and one's not going to the other. Back when we were doing the facial stuff, that's also something important to take a look at. When they're smiling, when they're frowning, when they're puffing out their cheeks, when they're moving their eyebrows up. If you notice any deviation from one side to the other, that can usually be a negative sign. So that's another thing that you also want to look at too when you're looking at their ability to keep their arms out, or the ability for them to do passive or active range of motion. Let's see. So you would assess their seat. Another important thing that you could do as well is you can do a Babinski reflex. You want to go to the lateral side of the foot and do like a hook shape on the lateral side of the foot. If their toes fan out, that's a bad sign for the older population who are not infants. That's usually a bad sign. So you want to make sure that their toes close up upon you trying to do the Babinski reflex.